Welcome to the recorded version of Caring for Someone with Alzheimer's, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
Our presenter today is going to be Dr. Amy Dupree. Dr. Dupree is a gerontological social worker and an internationally renowned expert on lifestyle issues relating to caregiving, retirement, aging, and family dynamics. Dr. Amy is president of Essential Conversations, Inc. and Dr. Amy, Inc., a company dedicated to family caregiver wellness. Dr. Dupree holds a PhD and master's in social work, specializing in gerontology, and earned her CSA, a designation for which she also trains others as part of their accreditation. Dr. Amy Dupree is a much sought-after speaker at corporate and professional events on the topics of caregiving, aging, and retirement, and she is a frequent guest on radio and television. And with that, I would like to turn the floor over to our presenter, Dr. Amy Dupree. Welcome.
Well, thanks, Steve. I appreciate that. And I'm really glad to be here today talking about this topic because this is a topic, as we know, that impacts so many families. And throughout my career, I've had the great opportunity to work with families who are really wanting to cope better with this issue, with their older parent that may have dementia or with their spouse who may have dementia. And certainly even with the folks, more and more now we work with the actual person with dementia to have better quality of life. For early in my career, we didn't even think about those sort of things. And today, of course, we know that people can have wonderful quality of life with dementia for a long time. And last week I had the great opportunity to keynote at the Northeast New York Alzheimer's Association conference, where they had a fabulous turnout of families really seeking more information and support. And hopefully today, all of us on the line will walk away with something that helps us better help families. And during the Q&A session, I'm sure that many of you will ask questions and offer things that will inspire each other. So let's get started. When we look at this slide, you see that, according to research, this is from the Indiana School of Medicine, by the time we reach the age of 65 or more, a quarter of us may be wrestling with failing memory and other mild cognitive problems. It doesn't have to be full-blown dementia. Many people I know you hear joke about, I've got Alzheimer's disease, but nobody's really laughing or joking if the cognitive impairment strikes their parent or another family member. Often that laughter really turns to fear. Now, as you know, the good news is that not all signs of cognitive impairment mean that someone has Alzheimer's disease. Many health issues, even something as simple as a vitamin deficiency, can lead to cognitive impairment. And in some cases, the symptoms are reversible. And we also know that there really are activities that can both prevent cognitive issues as well as improve cognitive functioning if someone does have a cognitive disability. So with that as a background, let's go over what we're going to discuss today in this webinar. Today, what I'm going to do is first I'll start, obviously, by giving you the definition of cognitive dysfunction and the symptoms that might demonstrate that you have a client that's suffering from some of its effects. And then I'll also talk about some of the problems and the causes of cognitive issues, including those related to Alzheimer's disease and other dementia. And then lastly, I'm going to give you some ways to help your older clients and their families cope better with cognitive impairments. Because as we know, this doesn't just impact the person who has the issue, it impacts their whole family. So let's start by talking about the definition and the symptoms of cognitive impairment. First, let's talk about what cognition is. Let's start with that. So the definition of the word cognition means the process of knowing. And as you can see there, it includes aspects that you see, such as reasoning, awareness, perception, knowledge, intuition, and also judgment. Cognitive skills are really the mental capabilities that we have that allows us to process all the information we receive from our five senses. These skills are what we need in order to be able to think, to talk, to learn, to read. There's what gives us the ability to recall things from memory. Cognitive skills are also needed to analyze images and sounds. They help us maintain our concentration and draw associations from various pieces of information. Now, let's talk about what all that means practically. You know what this is really about? It's really about the ability to function in the day-to-day world. For example, if someone's having difficulty processing information from what they see or hear or taste or touch, it can really be a problem just getting through the day. And, we don't usually stop and think about this, but it really is how we get through our life and our world. We're always processing information from our senses. So when you're enjoying a really good meal, obviously you're processing what you're tasting and smelling. When you touch a hot stove and you pull your hand away, you're processing from touch. And when you're driving, you're processing lots and lots of information visually. So again, although we don't step back and think, which sense am I processing from, we know that's going on. So given that background of that's what cognition is, let's take a look at what happens when our processing gets faulty because of cognitive problems. So cognitive problems are also referred to as cognitive deficits or dysfunction. And what happens is they occur when a person has difficulties processing information. So that includes mental tasks such as paying attention, thinking, language, emotional behavior, and memory. All of that those are mental tasks. And when we have problems with that, we say we have cognitive problems or deficits or dysfunction. Now, there's something called mild cognitive impairment, which is also known as MCI, and this is a stage between normal forgetfulness due to aging and the development of dementia. In general, those symptoms don't interfere with everyday activities, and they do include forgetting recent events or conversations. They include difficulty multitasking or solving problems and taking longer to perform more difficult mental activities. But I think what's important here when we look at the difference between just normal aging and some of the changes and mild cognitive impairment, there's a pretty high percentage of people who have MCI or mild cognitive impairment who do end up developing full-blown dementia later. And there's research going on right now that's looking at how we find dementia earlier. In other words, before you see the full-blown symptoms, how do we recognize somebody's got the problem so that hopefully we can stop its progression? And then, of course, you see that another type of cognitive dysfunction is dementia. And what that means, what the word dementia means, it's the loss of cognitive functioning and intellectual reasoning. And it's caused by changes in the brain caused by disease. And this is key because we're going to talk in a little while about how often what happens as a family member is that we want to sort of reason things out with someone. Don't you remember that this is your house? Those are pictures of your grandchildren. And they can't because there have been changes in their brain, and the changes in their brain, which are caused by the disease, don't let them reason anymore in that way. So that means that people who have dementia tend to repeat questions. They often become disoriented in familiar places. They may start neglecting their hygiene or their nutrition, and they get confused about people or about time. They no longer can track those kind of things. Now, many of us talk about Alzheimer's disease, and when we think dementia, we think Alzheimer's disease. And the reason that is it accounts for about 2/3 of the cases of dementia. That's a lot. So 2/3 of the cases of dementia are caused by Alzheimer's disease. Now, we're going to talk more about that in a few minutes, but right now what we're going to do is look at the symptoms of dementia in more detail. When many of us find ourselves forgetting things, maybe if you're like me, more frequently than you did in the past, you may start worrying, geez, do I have dementia? But, just forgetting, just that one thing, is not dementia. I worked in a geriatric assessment clinic early in my career, and that's a place where families bring someone they love who they think might have cognitive issues, and they get assessed, and usually assessed in a very thorough manner. And what we used to tell the families who came as a way for them to understand the difference between just forgetting and dementia is that it really is the difference between forgetting where your car keys are and then holding your car keys in your hand and no longer having any idea what to do with those keys. That's what happens to someone who has dementia. It's not just that they forget more often. There are qualitative changes that happen, things that are very different, and no longer do they know what keys are for. So this is a big difference. And so if you are experiencing some changes in your memory, that's not so much of an issue. Now, what I always say to people is, if you do find that when you open your refrigerator, your running shoes are in there, and you that's probably a problem because most of us don't store our running shoes in our refrigerator. That's the kind of things we see with dementia, something that is completely out of the realm of what we would consider normal. So things to think about. Okay, so other symptoms of dementia. And it's really good to be familiar with these symptoms of dementia, whether or not your family member is showing signs, because what you can do is sort of track the progression this way if they already have dementia. But if they don't have dementia, it's an opportunity for you to start noticing. Are there problems? I hadn't noticed that before. Because, the truth is, it's often several years into Alzheimer's disease before someone gets a full diagnosis. And the reason is because the changes are subtle. They don't happen very quickly. And for a while, we often excuse some of the changes, and the person covers up for them. And we may say, that doesn't really seem like that big a deal. I don't know. Is that really a problem? So being aware of these as a family member can be really, really helpful. So let's talk about the first one, becoming disoriented. This is something that we see with people. In early stages, we start to notice some disorientation. And I'll tell you about my own parents in this, and my father, who lived to be 85, and he seemed to be very good cognitively. He didn't have a lot of issues, but there were some things that were starting to happen with him that made me wonder if he was developing Alzheimer's disease. And this was one of the issues. He would get disoriented in a way he hadn't previously. So a couple of ways that occurred. One was when he and I would drive somewhere together, and it was a place he was very familiar with and had driven himself there many, many times, he started getting out of the car and saying to me, "Now, where are we exactly?" Or, "How did we get here? What was the route we took?" And here's the issue, and this may be true for you and your family member. Things are rarely clear-cut, and one of the reasons this wasn't clear-cut is my father had macular degeneration, so his eyesight was very bad. So I wasn't sure if some of his confusion on the route and where we were was caused by the fact he couldn't see very well, or if this was a cognitive issue. Now, another way he expressed to me that he became disoriented was in the mornings when he would wake up. And I'm sure many of us have had that sensation sometimes when you wake up and being a little confused, maybe not exactly sure, what time it is or where you are. And my father said to me that would last for him for longer periods of time. What he noticed was that he would wake up and he would think that my mother at this time had passed, and so she was no longer, with him, and he would think she was still in the house and think that the children were still in the house. And he said, "I notice it takes me a while to be able to shake that." So that's the kind of disorientation we're talking about in time, in place, those kind of things. Now, again, my father never had that develop past that stage, and perhaps had he lived to be 95 instead of 85, we would have seen that progress. But those are the kind of things that when I worked at the geriatric assessment clinic, people would come in and say, I remember a few years ago, my parents started talking about this. So some things to pay attention there. Language problems, such as trouble finding the name of familiar objects. And again, you will notice that people do this more frequently as they get older. We're learning ways to keep our brain active so this happens less, but it is something that happens. I actually heard a comedian this past weekend who did a very funny routine about her own aging, and she couldn't remember a word as she was doing the comedy act, and she said to the group, she kind of got everybody involved trying to remember the word, and she said, I'm beginning to find that going through life is like playing an endless game of charades. So I think, many of us experience that with aging. That's different. This is significant language problems. Can't remember the name of an object, not just it's not on the tip of your tongue. Misplacing items. And again, this isn't when you walk around with your glasses on top of your head looking for your glasses. It's when you truly are misplacing things in places that are a bit bizarre, or it's happening frequently. I'm reading a book about a woman who's caring for someone with Alzheimer's disease, and she talks about the fact that this woman loses her teeth constantly, and what she does is she's putting them places without realizing, and places such as between the couch cushions or places that they have to actually go kind of play a game of hide and seek for. Personality changes and loss of social skills. This is, again, one of the things that family members told me a lot, that they would notice in retrospect that there were personality changes with their aging parent who was later diagnosed with dementia that they could look at years earlier. So perhaps being more touchy, more, they were feeling, getting more frustrated, getting angry at easier. Those sort of things, if you start noticing significant personality changes, are things to be aware of. They're key. Becoming, just uncharacteristically irritable is what I'm thinking about in that. Loss of social skills, and this shows up in a couple of ways, but people saying and doing things that perhaps are a bit inappropriate. And again, in the beginning, they're often subtle, but this gets worse as people move from beginning stage to middle stage of Alzheimer's. And then withdrawing from social contact. This is very key. We notice that people start to pull back, especially in the early stage, from spending a lot of time with people. And family members will comment on this a lot as well. They'll say, he used to be so social, or she used to be so social, and what I've noticed is now that he never wants to go out of the house, or we're having a family gathering and he leaves the room. One of the feelings about why that happens is people get overwhelmed, they get overstimulated. Their brains can't process all that information. So withdrawing from social contact is a way to sort of manage that overstimulation. And then losing interest in things people once enjoyed becomes a problem. Again, potentially because they're unable to process it. It's too much for them. We talk about people having a flat mood, which means, losing the highs and the lows, getting sort of just not really experiencing a lot of emotion at all. Difficulty performing tasks that might take some thought, but that the person was used to doing, such as balancing a checkbook or playing a game or learning new information or routines. And certainly when you start seeing things like difficulty doing basic tasks, such as preparing move or choosing appropriate clothing and driving, that these are big issues. Now, then, as you move down through these, when you look at other potential symptoms, forgetting details about current events. So, usually people start by forgetting the past, or the current, and then move into forgetting the past. So when people start forgetting these details about the current events, that's a sign in the beginning that something's going on, because they can likely still remember the distant future, or what we call long-term memory, but it's their short-term memory or the recent past that disappears. Forgetting events in their life, or losing awareness of who they are, or not recognizing other people. Now, typically that happens later, and that people start losing awareness of who people are. They may recognize them but not be able to pull up the name. And early signs, again, are if someone's sleep patterns change, that's very key. If they have difficulty reading or writing, you think about that, that's processing information. If they have poor judgment on things, they do things they shouldn't do, like walk out in the road, that's a problem. And again, we talked about they becoming easily upset. Now, a couple others I just want to mention to you that are not on this list, but things to think about. Obviously, things like hallucinations, striking out, violent behavior, delusions, depression, agitation, becoming easily upset in social situations, any place where someone's out of their comfort zone, when you notice that they're getting more upset. And then very late, we see things like incontinence and swallowing problems. Now, if you start to see these signs, even the mild ones, it is a cause for concern. And the quicker that you can get someone in to get help, the more likely you may be able to extend their quality of life. Early intervention really, really does matter. So we really want you to think about, if you haven't done this and you have a family member showing these symptoms, I want to encourage you to think about getting a full assessment, a full medical assessment. Okay, so next what I'd like to do is provide some background information for you on the potential causes of cognitive problems. So not all cognitive impairment is a result of Alzheimer's disease or other dementia. You see there in the first bullet point, things like stress and anxiety and fatigue have all been found to affect memory. Actually, studies have shown that older men with elevated levels of the stress hormone epinephrine are more likely to suffer from mild cognitive impairment than their peers are who have just normal levels of epinephrine. Another study showed that everyday stresses combined with major stressful events can exert a cumulative effect over a lifetime and exacerbate cognitive decline. So stress is a big thing. Now, many of our parents who suffer from diseases associated with aging, such as heart disease or cancer, may end up with cognitive dysfunction as a result of the treatment of those conditions. For example, Duke University Medical Center's researchers found that 2 years after major non-cardiac surgery, 42% of elderly patients will have experienced a major cognitive decline. Isn't that amazing? 42%. So again, these things are impactful. And cancer treatment, the various types of cancer treatments, are a common cause of cognitive problems. If you're interested in reading more about this, there's some information on cancer.net. And cancer.net reports that approximately 20%, so 1 out of 5 people, who undergo chemotherapy will experience some cognitive problem side effects. So radiation treatment to the head or neck is also a known cause of cognitive problems. Other conditions or symptoms related to cancer or cancer treatments, which include things like anemia and fatigue, stress, depression, insomnia, high blood calcium, and electrolyte imbalances, can also result in cognitive dysfunction. And other causes, we have, if you talk about hormone therapies, you see there on your screen, medications can sometimes cause cognitive issues, including those for anti-nausea or antibiotics, pain medications, antidepressants, heart medications, those that are used to treat sleep disorders. And we especially see this in older adults, that many of the medications that might not impact you and me that way could impact your aging parent that way. So being very aware of what medications they're on and what the changes you're noting in cognitive functioning is really key. Infections are another big issue, especially those of the central nervous system that can cause a high fever. But one of the most common causes of some cognitive issues is a urinary tract infection. We know that people with what we call UTIs, or urinary tract infections, their first symptom as an older adult usually is confusion. And I really saw this with my mom. My mom had a massive stroke, and she was incontinent, and my mother was catheterized for many, many years, and she had chronic urinary tract infections. And in the beginning, what we didn't realize was that those infections were really contributing to her confusion. And there were, the first few times it happened, we as a family thought she was having another stroke. And then when she went into the emergency room, I'd say to my dad, make sure they check her urine to see if she has an infection. And every time she did, when the infection cleared up, her additional level of confusion cleared up. She still had ongoing confusion. But making sure that you watch that is really key. I had a person in a class that I taught once who told me that his mother-in-law had actually died from a urinary tract infection, something nobody should be dying from at this stage. And he said the reason was because no one thought to take her to the doctor with the confusion. They assumed the confusion was simply related to her having aging memory issues. So this is a big one to stay aware of. And then you see there not having enough of specific vitamins and minerals. For example, iron and vitamin B or folic acid are things that people need the right amounts of, or they can start showing cognitive issues. Untreated vision problems can cause cognitive problems, and things like MS and other brain or nervous systems. And, of course, strokes can lead to this, as well as we said, 2/3 of the causes of dementia causes are Alzheimer's disease. So I think the key here, again, is that we have to recognize that people really, really need to have a good assessment. You're going to hear me say that over and over again, because one of the things that's concerning to me is I know a lot of families don't do that. And when you look at the issue of depression in older adults, depression and dementia, if you put their symptoms side by side, 2/3 of them are in common. Only 1/3 of the symptoms are different between dementia and depression. So we want to make sure that people are getting treated for the right thing and that they're not just assumed to have dementia and then there's nothing that can be done about that. Okay, so talking about the massive stroke situation of my mother, I want to tell you that this is an issue. As I look back, my mother had significant cognitive deficits. And one of the things that happens when someone does have a stroke, they can have mini strokes or they can have a massive stroke. My mother had a massive stroke, but mini strokes can also lead to cognitive issues. And just like someone with Alzheimer's, she could no longer process well at all. One thing I noticed with my mom was I had to give her one instruction at a time, which is one of the suggestions that you will see in a later slide that you do if you have a family member with dementia. And the reason is they can't manage more than that in their brain. So my mother was in a wheelchair, and if I was helping my mom move from her wheelchair to the bed, I had to make sure that I only told her to do one thing at a time. For example, Mom, put your foot on the floor. And so she could do that. But if I said to her, Mom, put your foot on the floor and put your hand on my shoulder, she couldn't do those two things at the same time. And then the next thing I'd say is, okay, now we're going to rock to the count of 3, and then she'd do that, and I'd help her stand and pivot over to the bed. But everything had to be given one instruction at a time. So again, whether it's Alzheimer's, whether it's stroke, this is a key thing. The other thing with my mother, another story I'll share with you was one time I was having tea with my mother, and it was the middle of the afternoon, and we were sitting in the living room, and she just took her teacup and poured the tea on the living room rug. And she wasn't upset. She just kind of looked curious and poured it. And I said, Mom, what are you doing? And she started laughing and laughing and laughing. She had no idea why she'd done that. That's the thing. The brain has been shifted. We don't know why these things happen. We just know that people no longer can process. Okay, so the last bullet point there is about Alzheimer's disease. So let's talk about that. You know, Alzheimer's disease occurs when the nerve cells deteriorate in the brain, and that's due to a buildup of what we call plaques and tangles. That's really the hallmark of Alzheimer's disease, is this idea of the buildup of plaques and tangles, which actually results in the death of a very large number of brain cells. Doctors don't really know why this occurs, but research is underway to determine both the causes and, more importantly, the cure. According to the Alzheimer's Association, 4.5 million Americans are right now living with Alzheimer's disease. 4.5 million. Isn't that amazing? As you know, it's important for us to remember that getting Alzheimer's disease is definitely not a normal part of aging, and that's really key. This is not normal. In fact, the causes of Alzheimer's disease are not entirely known, but we know that they likely include some genetic and some environmental factors. Now, that makes people nervous if they know their parent has Alzheimer's disease and they think, does that mean I'm going to get it? And the answer to that is no. No, that we don't know the causes, but we know that the family history part of this is really very tricky. And it's a really good idea if you're worried about that you talk to a doctor about that so that you don't worry about it, because it does not mean that you're doomed to get Alzheimer's if you have a family member who has it. A diagnosis of Alzheimer's disease is made when certain symptoms are present, and also by making sure that the causes of dementia, other causes of dementia, and cognitive dysfunction are not present. So in other words, what you're doing, that they're ruling out things. They're ruling out that someone has a vitamin deficiency. They're ruling out that it's depression. So it's really a diagnosis by ruling things out, because we don't really know for sure that someone has had Alzheimer's disease until autopsy. But we now can rule out well enough to be pretty sure what's going on. Okay, now here's what I'd like to do next. I want to talk to you about how you can better cope with your aging parent's cognitive problems. So I don't need to tell you that caregiving for an aging parent under any circumstances can be really challenging. But when we add in the symptoms of increased forgetfulness, absent-minded behavior, perhaps some aggression, the caregiving can really be pretty daunting. So what we want to do is talk about how can you better manage this. So as a starting point, you see there, consult with healthcare professionals and make sure that you get a full assessment for your family member, which includes neurological testing, as well as ruling out things such as depression. So you can start with a family doctor. However, there's probably going to be testing and things that have to occur that the doctor will have to refer you. Now, after you get a diagnosis, then, of course, what you need is a course of treatment, a recommended course of treatment. There are many things you can do to support your aging relative who has dementia. So let's talk about those now, and this is sort of above and beyond the medications and thinking about those sort of things. These are very practical things. So the first thing you can do is encourage your parent who has dementia to write everything down, really everything. So this means keeping track of appointments, activities, important dates. They can use an address book, a date book, a calendar. Actually, a big calendar in the kitchen can be a really great tool for this, something where people can write things down on a regular basis to help. So this is all about visual cues we're talking about. In fact, what you really can do is suggest they write down every new piece of information. Now, that may sound daunting, but it really can work very well if they just carry a small notebook, and they can carry that in their purse or their pocket. And when they're somewhere, they can write down phone numbers. They can write down information they need to remember. If they get to a point where the words are no longer coming for them, then you can really encourage them to use pictures if that helps them understand or remember the concepts later on. Now, think about how you would feel in this situation. Most of us don't want to appear silly or inept, so we don't ask people to repeat information. However, if this is your family member, you really need to encourage them. It's okay to ask someone to repeat something. We really need to encourage people to do that. Sticky notes are also very helpful for families to use to leave reminders. So for your parent, you can leave reminders in places where you're starting to notice trouble. For example, if they no longer can remember how to use the coffee machine, write the instructions down on a note and stick it right on the machine. That way, when they get up, they want coffee, they know exactly what to do. Now, obviously, this only works for certain time periods. You can't do this forever, but you will get a period of time that your family member will still be able to read those notes and do what the note says, even though they can no longer remember what to do. All of us can improve our cognitive functioning through two types of exercise, mental and physical. So we know now that there's an expression that anything that's good for your heart is good for your brain. So exercise would be one of those things. That's physical exercise. And just like our muscles, the more your parents exercise their brains, the more they'll be better able to process and remember information. So this idea of exercise is really key. One of the interesting things about brain exercise is that we know what makes it work really well is the idea of novelty and sensory stimulation. So think about this, what novelty means. Doing it in a new way. So if someone has a regular route to the grocery store, suggest they go a different way. Or when they get in the grocery store, to walk the opposite way through the aisles. All of those things help our brain get off of autopilot. So you can think about this for yourself, too. When is your brain on autopilot? When do you perhaps need to try something different? I've also heard the suggestion of when you shower, showering in the opposite way that you normally do. So, if you start by washing your hair, end by washing your hair. That, again, just doing things that stimulate the brain around novelty can be really, really useful. Now, perhaps your loved one has gotten to a place that they can't leave the house. There's still things that you can do to vary the routine. So using your non-dominant hand to brush your teeth. So if you're right-handed, switching to your left hand. Or even wearing a watch on the opposite wrist forces you to do things that are out of the ordinary. As we said, too, the physical activity is key, but it doesn't mean that somebody has to run a marathon. You really can have them and you engage in many physical activities like brisk walking, raking leaves, taking the stairs. Anything like that can be counted as exercise. And the more we push ourselves to take the stairs instead of taking the elevator or walking longer, we're doing exercise that's good for us. Now, if your aging parent is confined to a chair for much of the day, try to find ways to encourage movement in their life. So doing leg lifts or grasping a tennis ball, even swirling scarves through the air can exercise your arm muscles. So just moving. We're really meant to move, and when we move, it stimulates our brain, so it's a good thing. Now, as we talked about earlier, stress and anxiety can increase cognitive dysfunction. So it's important that we encourage our aging parent and also ourselves to stay calm if you start noticing their memory failing. If someone becomes nervous every time they can't remember something, it's not going to help. So you want to just quietly assure them that some memory loss is normal and they'll remember it later on. and then just do whatever necessary to reduce the stress and anxiety. The last couple things you see on there I want to mention are redirecting during challenging behaviors. This is something that works so successfully. So in other words, if you're doing something and your parent starts to get frustrated or angry, you can just very gently suggest that you change, maybe go get a snack and get out of the room if you're doing something. Or how about if we go outside for a few minutes? Anything that gets them off of what they're focused on at that moment. And again, you can do this very gently, and it's amazing how people respond. So I'll share with you a story with my parents that I found very interesting to watch, and I also was amazed in many ways that my dad struggled so much with this with my mother. But, you know, my mother would often, especially in the beginning years, she lived 8 years after she had this stroke, and in the beginning time, she would be often quite obstinate. She just refused to do something. And the best way I found was just to change the subject, move things, and that she would then come back and be willing to do it a few minutes later. So one time I was there, and my mother was refusing to eat. And my father had made her lunch, and he was quite frustrated. He always worried when she wouldn't eat. So he was frustrated by this, that she wouldn't eat. And she kept saying, no. And so he kept trying to cajole her into eating. Oh, come on, Alice. You know, you really like this. And this is the type of thing that is almost always ineffective. So after a couple minutes, I just kind of motioned to my dad, you know, to let me handle it. And so I said to my mom, are you done eating? And she said yes. And I took her plate away. My mother had very little speech, but she could communicate those ways. And my father looked at me surprised, worried she wasn't going to get her lunch. And then after about, 5-10 minutes, I just went into the kitchen, took the plate, and brought it out and said, look, Mom, I have something I think you really enjoy. And she sat and ate the whole thing at that point. So again, sometimes just stopping the interaction and redirecting can be one of the best things you can do. Arguing and pushing the situation rarely works. The last bullet point you'll see there is using the life story as a guide. This means thinking about the things that your aging parent loved. So you can think about this in many different ways, and I'm going to recommend to you in doing this that you might want to actually get on a website that will help with this, that will give you some suggestions. If you get on caregiverstress.com, their Home Instead Senior Care now has a fabulous video series for families about how to better cope with their relative with dementia. And one of the short video series, they're all very short, just a couple of minutes, is about how to use the life story as a guide. So thinking about things your loved one used to love to do, and then using those. So, for example, in one story, there was a woman who had lived on a farm, and she loved getting up to do the chores. That was part of her life. And so what the family would do when she wouldn't get out of bed and didn't want to be active was they'd say, it's time to do the chores, and that would get her up. So finding ways to use the life story to deal with difficult behavior and also just to create more joy is a great way to go. Okay, let's talk about some specific communication tips that might be helpful for you too. By the way, these tips work well whether your family member has dementia from Alzheimer's or from another cause. What they do is they really make life easier for everybody. So these are from the National Institute on Aging, and they're very good recommendations. Getting the person's attention is really key. That's the most important thing, is to make sure you've got their attention before you start talking. You know, what I found with my mother, and I've seen this with many clients with dementia, if there are multiple things going on in the room at the same time, the person can't usually attend to what's happening. It's very hard. So what you have to do is make sure you get their attention. I noticed this if I was in the living room with my parents and the phone rang and my father picked up the phone, my mother almost always would get distracted by that and could not focus on anything I was saying. If I needed to talk to her, I'd have to go right over to her and look her in her eyes and say, Mom, and get her to give her attention to me. Addressing the person directly is for the same reason. And then using simple, direct wording helps. So as I said to you with my mother, saying, go ahead and put your foot on the floor, but to do it very slowly and to give her very direct, one-at-a-time instructions. Speaking distinctly and at the natural rate of speed, remember what we said earlier, this is all about processing information. So we're talking now about processing information from the ears and from reading lips. And remember that people with dementia are not as able to do this. So it's really key to slow down, but to talk normally. You don't want to sound as if you're talking to a child or someone who has limitations. You want to talk at a normal rate of speed, but very distinctly and slowly. Okay, and then if necessary, explain who you are. Explain why you're there. Now, this is very hard for families because we look at the person who has dementia, who we have loved forever, and we can't believe they can't remember us. And they may remember you one time and not remember you another time. So by saying, I'm your daughter, I'm Jane, I'm your daughter, and I'm here today to take you out. We're going to go have a fun time together. You may need to say that a few times. Really supporting and reassuring the person. Again, this can be as simple as acknowledging when responses are correct, like, oh, that was good, you said that well. Or if they grope for a word, gently providing some assistance without overstepping too much. And again, as we said, presenting one statement or question or direction at a time is really, really key so that we don't overwhelm someone's brain. Now, it's likely that you're going to need some support during all of this. And that will include other family members, friends, and it may also include professionals to help you care for your aging parent who has dementia. It's really important that you don't try to go this alone. This is not something that very many people can manage on their own. And a lot of times family members feel that in order to be a good daughter or a good son or a good spouse, they should be able to handle all of the care. And what I always say is, it's not about you doing everything. It's about you making sure the person you love gets the best care possible. So you may need to ask for some assistance, and you may need to ask for specific assistance. Caring for someone that we love who has a memory loss or dementia is both physically and emotionally wearing, and you want to be able to go the distance. And so what we're really talking about, especially with something like Alzheimer's disease, is we're really talking about the difference between running a marathon versus running a sprint. So what you need to do is you really need to make sure that you're set up to run the marathon by having the support that you need. The other thing I want to talk to you about is the idea that when you look at the person that you love who has dementia, try to remind yourself that things are not the same because they're going to look the same. And what we tend to do is we tend to remember their lives as a whole. We have a filter for them that includes all their past behavior. And it's hard to just look at them in this moment and react to what's happening in the moment. So, for example, I think of this with my dad, who served soup and sandwiches every night for dinner to my mother and for himself because they had a full meal at lunchtime. And my dad would vary the soup at these meals, and every so often he'd serve vegetable soup. And every so often when he served vegetable soup, for reasons I have no idea why, my mother would spend the entire meal picking the vegetables out of the soup and putting them on her napkin next to her. And I have to tell you, my dad, who was incredibly patient, loving, and kind with my mother, became enormously frustrated by this. And my father had what I joke to be the vegetable soup theory, which is that my mother did this specifically to irritate him because she knew it bugged him, and that she had always had been sort of the matriarch of the family and now had lost her ability to do that. So this was one way to have control. Now, I have to tell you, I don't really think that was true. My mother's cognitive abilities were very, very limited. I don't think she had the ability to reason all that out or to even go in the direction my father thought. But what I knew was that my father saw the movie. He knew the whole life story of theirs and the 57 years they spent together. He didn't just look at her in the way she was today. And as a family member, that's both the gift and the challenge. The gift in that is you have these wonderful memories of this person that often sustain you during these difficult times. The challenge in this is that this person isn't the same. Their brain has changed, and they will not react the same way. So because of that, we need a lot of support, and we also may need some resources. So let's talk about some resources now that we can use. So here are a couple of resources that I would recommend that are excellent. The Alzheimer's Association is a fabulous resource. You see a phone number there. You also see a website. If you get on the website, you can click on your area. You can get specific information for the Alzheimer's Association near you. Also listed there is the National Institute on Aging has an Alzheimer's Disease Education and Referral Center. Excellent information on there. And Caregiver Stress that I mentioned to you before is a wonderful website that has great information for family caregivers, all for free, that's very practical, that will help you in managing a lot of the issues that you may be dealing with. Okay, so now let's talk about next steps. Where do you go after today? One of the things you can ask yourself is, what information do you need? Do you need more information about the disease or about how to better manage? There are wonderful resources for managing challenging behaviors, for figuring out more activities to do. So what do you need to explore, if anything? And do you need some education around those behaviors? Do you need some help? And again, we gave you a couple of resources. There's also fabulous support groups that the Alzheimer's Association runs. I really recommend those. So what I'd ask you to think about is, what is it that you need to do to improve this situation for the person you're caring for and for you, so that you can go the distance and so that your family member has the quality of life that you want them to have for as long as possible. I'm now going to pause, and I'm going to turn this back to Steve, who's going to open up the phone line for questions. Steve?
Great. Thanks a lot, Dr. Amy. A lot of great information in this web seminar so far, so thank you for that. And as Dr. Amy mentioned, it is time for the Q&A portion, so please text in those questions, and we will pose them to Dr. Amy. Also joining us on the call is Mary Alexander from Home Instead Senior Care. So welcome to the Q&A portion, Mary. Okay, let's get right into it, Dr. Amy. First question, my mother was just diagnosed with dementia. Money is already tight. Where can I find some resources without spending a lot of money?
Okay, and actually, Mary, are you on the line? Because Mary is a great resource on this.
Yes, I'm on the line. So Steve, could you repeat the question?
Yeah, Mary, the question is, my mother was just diagnosed with dementia. Money is already tight. Where can I find some resources without spending a lot of money?
Well, I think that there's some things that you need to do. There are a lot of community-type resources. There are two great areas that I would start with just to help create kind of what we call a care plan. I would go to your local Alzheimer's Association. A lot of times they have some specialized state funding for respite-type care and other areas. They also can help you with support groups. And it seems like people in support groups tend to have a lot of the answers, or they've already gone through a challenge like you have. The other resource I would check in with your local community is the Area Office on Aging. Again, the Area Office on Aging can also direct you to local resources, both for a fee and ones that don't charge a fee, depending on your circumstances. If your mother is in a situation or your parent is in a situation that they may qualify for other government assistance, they can also help you kind of start that path and start that paperwork.
Okay, the next question here, and this is a very pertinent one. I think this is a really great question for our two participants here. The question is, how do you begin this conversation with an unwilling parent who is showing signs of dementia but still values her independence?
Yeah, that's a really good question. And, these conversations are not easy, but they're really important. And I think, again, the best way, and I say this often because I think it's so key, is we have to remember to approach these conversations with understanding how this feels to the person we're talking to. So think about talking about this from the standpoint of wanting to help them maintain their independence. So, Mom, you know that what I want is for you to stay independent, and I want to help you with that. But there's some things I notice that have been concerning to me. and then you can talk about that. Now, one of the things that I can tell you in working with many families is sometimes people will go to the doctor or do something for someone they love when they won't do it for themselves. So one of the things you can say is, this is really concerning to me. If your mom says, I'm not going to do anything about this, would you just go for me so that we could go together and talk about this? Because this is upsetting to me, and I really want to be there to support you. So being able to be respectful and gentle and very clearly talk through some of the issues. Now, there is a great resource on caregiverstress.com, which is the 40-70 rule, and it tells you about how to approach these conversations in even more detail. And Mary may have something that she'd like to add to this, too.
You know what? I would just, I'll reiterate what Dr. Amy said, and it really starts with the conversation. If you go into it with a, Mom, you need to do this. Mom, I want you to do this. Mom, I'm concerned. You can't do this anymore. I'm going to take away your keys. You're not going to get anywhere in the conversation. If you start the conversation by saying, either I'm worried about you and it, all my life you've helped me, maneuver through and grow up. I want to do the same for you. I want to help you age the way you want to age. I want to make sure you're living the life the way you want to live it. So what does that look like, and how can I help you? So if you go into it with I'm here to support you, I'm here to help you, I think the conversation will have a much better outcome.
Okay, the next question. How do you recommend getting siblings and family members to all get on the same page?
Well, I'm going to start with this one, and Dr. Amy has helped me through some of mine. I went through, unfortunately, a terminal illness with my mother, and my siblings and I were absolutely not on the same page. So at Home Instead, we created a program called the 50-50 rule. Again, that's on caregiverstress.com. And we created that because I was surprised that I have a good relationship with all of my siblings, but we all saw my mom's condition differently. Some of us were absolutely knew what the outcome was going to be. We understood what the doctors were telling us, the time frame. And some siblings weren't at all ready to hear that my mother was going to die. And so I think, we all had a different approach to it. We very quickly had to have some open, honest discussions with each other. And we all figured out that we all had a role to play in the care of my mother. And so we each split up the task. One sister handled the finances. One sister handled, the food and the house. One sister handled all of her doctor appointments. That doesn't mean that she went to all of them. It just means she arranged them all. She was the primary contact with the doctor. So we all took our role. And my brother, who wasn't able to deal with it very well, he continued to run the family business, so we didn't have to worry about that. So again, it took us a good couple of months to all get on the same page, and there were some tears, and there was some spirited discussions. There might have been a few door slams, but again, it all came down to what was best for Mom, how do we do this together, and that's why we at Home Instead created the 50-50 rule.
Okay.
I'm not going to add much to that, Steve, except to say, I think I just want to say what Mary said is absolutely right on. And I think this idea of making sure you do have the conversations with your family member as best as possible and as early as possible is key.
Okay, great answer. Next question. How would you handle someone who has the same questions over and over?
It's interesting. I'm going to just tell from my perspective, and then I'll let Dr. Amy talk from hers. My grandmother had dementia, and it was interesting. My son at the time was 7, and my grandmother and my grandfather used to pick up my son every day after school. And it was interesting because as she started to progress, and she would ask, what's the weather like? What day is it? What's the weather like? What day is it? Over and over again. My son would always give her a different answer. And one day I said to him, Richard, why are you telling Grandma it's raining? It's not raining, it's sunny. I know, but Mom, if I give her a different answer, then we talk about it for a minute, and then she's not upset anymore. And so it took a 7-year-old to get me to realize that he knew exactly what she needed, without having any training or information or education, he just wanted Grandma to not be upset. And so I think you can kind of make it a game. If someone asks you the same question, give different answers, because really they're just having a conversation with you. It doesn't matter if it's raining or sunny or windy. They're not going to do much with that information. They're just simply asking the question. And you can also redirect them. Go take them to do something else. Give them an activity. Again, get their mind. It's kind of like thinking about a record that starts to skip. It continues to go over the same thing over and over again. Get them to do something else.
Yeah, and I think, the thing that does not work, and this is, Mary's ideas are great. The one that doesn't work is to try to argue them out of something, or to say, you've been asking this over and over. I just told you that 5 minutes ago. I think we have to, again, remember people's brains have changed, and they honestly we can't talk or reason them out of things. So they may ask the same thing 100 times, and you may have to, as Mary said, either give the same answer or change the answer or redirect them, get them so they're kind of out of that loop. I like that Mary's analogy about the record skipping, because it's getting them off of that and into a new song.
Okay, next question. This is kind of a specific situation, and the question is, my mom has Alzheimer's and is in the middle stages. She lives at home with a son that's disabled. Should we move her into a longer-term situation, perhaps another sibling's home where long-term care will be administered, or should we wait until she gets to the later stages? Some of us feel that she would be confused now by a move, but how confusing is the move when she is in the later stages of the disease?
I think there's a lot of factors that I think we're hard to give an answer on that specifically, because we're not assessing her. We don't know exactly, when you say middle stages, we don't know what that means. If she's still somewhat cognitive and can handle her activities of daily living, and she just has certain parts of the day that don't make sense to her, my belief is that you keep people home as long as you can, as long as they're in a safe, thriving environment. And so I would say try as long as you can to keep her in the environment that she feels most comfortable in. Once she gets to a point where the environment is not something she cognitively can understand, or it doesn't matter, at that point when you move her, she's already progressed down that disease. So my belief, and in our experience, is keeping them in their environment as long as possible is the best option. And you may have to go find services or family members to spend more time there, but that doesn't mean that's the reason why you take someone out of their home. Dr. Amy?
Yeah, I think it really, I like what you said, Mary, in the beginning about it being very individual. And so one of the things I think you have to look at is the whole family situation. And I agree, if we can keep people in their homes, that's wonderful. And sometimes it isn't possible, so you have to look, that's why you need somebody who will work with your family individually to look at what's the best solution, both for the person who has dementia, but really for the whole family unit. How are you going to manage this? Because the goal is that you want people to get the best care they can and be in the environment they want to be in. And also you don't want to have, as Mary said, an unsafe situation or something like that going on. So you really need to sit down with someone individually who can help you assess this. And that could be, again, either a geriatric care manager, which you can find on caremanager.org and click on your area. It could be someone from the Adult Services Unit of the Department of Social Services if you qualify for that. But make sure you have somebody who can help you figure this out, and that because what you don't want is, do people have regrets, and we should have handled it this way and done it this way. And I think that's where often as families we do need to bring someone in from the outside to help us figure these things out.
Okay, real quick follow-up question to the earlier conversations with family members that we were talking about, presenters. The question, would you have these conversations with your parent or with your siblings in person as a group, or with a caregiver present? Our mom has one child she depends on and responds to well, the others not so much. Can you provide us with a quick answer to that question?
Well, my quick answer is that if it's a family situation like that, I really recommend that you have somebody in the room with you who is an outside, a professional. And again, I mentioned geriatric care manager, a social worker, a coach. Someone who can help guide that conversation is going to probably do better than you trying to do it on your own. Mary, do you want to add to that?
You know what? I agree, especially if you know you're walking into a situation that may not turn out to be positive. If it's a family that gets along well and has some similar ideas about how to care for mom, and mom, even though she responds better to one child, as long as you can come to consensus and there's no arguments in front of mom and you guys are on the same page, and you can do that, great. If you can't, I agree with Dr. Amy. You need to hire someone to do that for you.
Okay. Well, we are just about out of time for this web seminar. I want to thank our presenters for another great session today, Dr. Amy Dupree and Mary Alexander. Thank you both.
Thank you very much, Steve.
Thanks, Steve.